Good evening, Jackie, and good evening to all our viewers and listeners, wherever you may be. Disasters and emergencies are by nature unpredictable. They affect communities in several ways. They cannot all be prevented, but we can plan and prepare to deal with them, and by so doing, save lives, reduce losses, protect survivors, preserve the ecosystem, enhance sustainable economic development, and assist the rapid return to normalcy. In early January last year, it became evident that this virus that started in Wuhan, China, was making its way around the globe. Prime Minister Harris and the Team Unity administration was alerted by our health professionals and by NEMA, and the National Disaster Mitigation Council was mobilized. Dr. Wilkinson spoke of the whole of government approach. This is what the Mitigation Council does, which comes out of the National Disaster Act and the National Disaster Plan. The Council has all permanent secretaries of all ministries, are part of this National Disaster Council, Mitigation Council. There are some 10 subcommittees that deal with such things as medical and public health issues, transport, utilities, and you have it. It covers all the gamut of services that make up our country. And so once the cabinet of the government of St Kitts and Nevis had been alerted, and led by our Prime Minister, the Disaster Mitigation Council was used to establish a national COVID task force. We did not wait until it was declared a pandemic to begin our preparations. We began a robust national education program for all levels of healthcare workers, citizens, and residents, so that they could be aware of the new viral disease, COVID-19. The World Health Organization declared COVID-19 a pandemic on March 11th, 2020, and we were not caught flat-footed like many other countries had. We followed the science and the advice of the WHO. Our local medical team, developed a national strategic preparedness and response plan for COVID-19, working with the National COVID Task Force. And there was the aim to do 4 things: to slow and stop transmission, 2, prevent outbreaks and delay spread, 3, provide optimized care for all patients, especially the seriously ill, and 4, to minimize the impact of the epidemic on health systems, social services, and economic activity. Our approach then, and still is, one of a whole-of-society approach. There has been coordination to support preparedness and response, including the health, transport, travel, trade, finance, security, and other sectors. We attempted to sensitize the public to their active role in the response and stress personal responsibility in this fight. We enhanced our hospital and community preparedness plans to ensure that space, staffing, and supplies are adequate for a surge in patient care needs. We continually assessed where we were and the effectiveness of what we had accomplished, and used that information to plan future preparedness and response activities. When our first imported case arrived on 25th March last year, we were prepared. And during the year, we have continued a robust testing, isolation, and quarantine program. We ensured that all who needed to be tested were tested using the gold standard PCR test, and isolated all positive patients and quarantined anyone with a potential exposure. But it's the legal framework that underpinned our response that I want to talk about. And I do so especially in light of the breaches that occurred this weekend in Nevis and here in St Kitts. The Emergency Powers Proclamation and Emergency Powers COVID-19 Regulations 2020 were the first laws enacted to specifically seek to control and mitigate the spread of COVID-19. And it was in that vein, on the advice of the Honorable Prime Minister, His Excellency the Governor General declared a state of emergency from Saturday 28th March 2020 in light of the imminent threat posed by the rapid and potentially deadly spread of the novel coronavirus on a global scale. Since then, we have passed into law 28 iterations of the COVID-19 regulations, each seeking to balance varying levels of restrictions and freedoms. The legal framework for COVID-19 includes various protocols and provisions to effectively manage the crisis, protect the vulnerable, and promote sustainable recovery. The legality of the emergency actions that were taken by the government to seek to protect the people in this country have been challenged in the courts of law and have been found to be reasonable or appropriate. These actions mirror those of the international community, and they were necessary, although they were inconvenient or unconventional. In the face of the threat of this health crisis, there were curfews and lockdowns implemented all over the world. The necessity of addressing the various concerns that arose out of the pandemic would have obviously demanded considerable legislative focus this year, last year, both through primary and subsidiary legislation. Consequently, would have seen the tabling and debate of a resolution to extend the first state of emergency promulgated by the Governor General that would initially have been declared in March of last year. Some of the legislation that were passed over the year included a public health quarantine regulations. This was SRNO number 2 of 2020 and was published as early as 21st February 2020. This SRO provided for the treatment of COVID-19 as an infectious, communicable, and notifiable disease and introduced the concept of social distancing. The next one after that would have been a proclamation declaring a state of emergency, as I had mentioned. Then there were such things as Emergency Powers Regulations, SRO number 7, that was published on the 23rd of March and introduced the concepts of working remotely, closure of businesses, curfew, physical distancing, shelter in place, and restriction on travel. As it involved better provided for quarantine and isolation. And I can go on in terms of the various iterations of the regulations that were had. We would have had such things as 24-hour curfews, night curfews, and days of limited operation. We would also have had, when it was no longer necessary to implement 24-hour curfews, and so forth. These iterations, these laws that were passed over time, would have ended up on the 17th of November 2020, when the Parliament would have passed into law the COVID-19 Prevention and Control Act. This act was intended to provide for an appropriate, sound, and valid framework as we continue to seek to protect the people in this federation from this disruptive and potentially deadly virus. Most of us are only too painfully aware of what the world statistics look like. In our own way here, we have not been immune to the incursion of this tsunami-like threat, which has phenomenal effects on our economies, on our businesses, on travel, and our way of life. I want to briefly look at the COVID Prevention Act, Prevention and Control Act 2020. It is a very comprehensive piece of legislation that is divided into some 5 parts and has a number of schedules that have been added to it. The key parts that our public must be aware of would be part 2, that deals with the administration of the whole response to this COVID pandemic. In part 2, which deals with the administration, the Chief Medical Officer has ultimate responsibility for the management of the public health response in COVID-19 on the island of St. Christopher and on the island of Nevis. And it sets out what all the Chief Medical Officer does. In that section 4 of Part 2, the National COVID-19 Task Force is set up. And it says that subject to provisions of Section 3 of the National COVID-19 Task Force, this is responsible for the coordination of the national response of COVID-19. And it goes on to set out what all the COVID-19 task force would be responsible for. I would just briefly look at the makeup of the National COVID-19 Task Force, which shall be comprised of the following members: the National Disaster Coordinator, who shall be the chairperson of the National COVID Task Force. The Chief Medical Officer is the co-chairperson of the National COVID Task Force. The Medical Officer of Health for Nevis, the Medical Chief of Staff of the Joseph France General Hospital, and it speaks to a senior representative of the Nevis Disaster Management Authority, a representative from the Ministry of Health, the Ministry of National Security, the Royal St Kitts and Nevis Police Force, the St Kitts and Nevis Defense Force, the Immigration Department, Customs and Excise Department, the Ministry of Foreign Affairs, Department of Information and Technology, St Kitts Air and Seaports Authority, the Nevis Air and Seaports Authority, and from time to time, other members of the public service are co-opted by these members. I cannot tire in commending the members of the COVID task force, which I've had the honor to oversee, along with Senator Phipps, and the exemplary manner in which they have conducted their onerous duties. The task force has given St Kitts and Nevis the enviable record of 0 fatalities from the devastating global pandemic that has ravaged the populations of the developed world. And when I say the task force, we must give kudos to the medical team that has led this task force and given expert science advice throughout. I want to look just at a couple other things in relation to the COVID-19 Prevention and Control Act. In Part 3, it speaks to public health interventions, which makes up most of the Act. And we speak at such things as work remotely from home, social distancing and physical distancing protocols, hygiene protocols, wearing masks outdoors, restrictions on social activities, education and religious instruction, weddings and funerals, public beaches, bars and restaurants. Speaks to hotels, guests, and similar establishments. It speaks on restriction on visitation, domestic travel, regional and international travel protocol, and so on. But it's a very comprehensive bill that covers all aspects of our life. And in it, we also establish that in Part 4, questions of testing and treatment, labs, laboratories that does the testing, who needs to be tested, and so forth, and the reporting protocol in relation to that. Part 5 deals with the miscellaneous catch-all provision. And in this, it speaks to the general penalty, which I must speak to. A person who contravenes a provision of this Act for which a penalty is not specified commits an offense and is liable on summary conviction to a fine not exceeding $5,000 or a term of imprisonment not exceeding 6 months or to both. And this is a very important provision because we can commit offenses if we do not adhere to the provisions of the Act. It also speaks to a fixed penalty notice issued by a police officer in accordance with this Act shall be lawful notice that the persons charged with the commission of an offense and that a complaint will be made against this person in respect thereof, requiring him or her to either pay the fixed penalty within 10 business days or to appear at the court specified in the notice on the day and at the hour therein. But this is also important as well, because in addition to breaches, offenses that may be had, you'd recall that recently in our parliament we made an amendment to this act to introduce where that the wearing of a mask now carries a fixed penalty, or the non-wearing of a mask in public places carries the fixed penalty of $100, and so forth. It's a very important point. I want briefly to speak about some breaches in the protocols that have occurred quite recently. Today, at the regular weekly meeting of the National COVID-19 Task Force, we deliberated on 2 breaches that occurred at a hotel establishment in Nevis and which are of some concern. The first breach occurred on Thursday evening, or on Friday, I believe, when a couple left a tour group that had been given a special permission to vacation in place at that hotel. Now, the concept of vacation in place means that an international visitor can visit pre-approved hotel locations, and they can stay for the first 7 days. And if, when tested after day 7, they're found to be negative, they're allowed to leave the compound and visit certain very selected locations. It could be Brimton Hill, our national heritage site, World Heritage Site, other historic sites, and so forth. But if you are to vacation in place in the hotel, you should not leave the hotel. And the couple breached that regulation and walked to a local museum in Charlestown. They had to be removed from the hotel, and they have been quarantined at the government facility at Potworks. Later that night, or in the wee hours of Friday morning or Saturday morning, 6 members of the group also evaded security and visited a local night spot. These are very serious breaches, and those 2 have had to be quarantined at Potworks on the guard, and tomorrow they will be brought before the magistrates in the magistrates court in Charlestown and will be dealt with. These breaches cannot be tolerated, and we in our country, St Kitts and Nevis, are very proud of the way in which we have managed the response to COVID to date. It is why we are the envy of many in the world that we have done so. Our protocols are strict, but it has given our people the sense that we are COVID-free. And so we want to insist that all our citizens should adhere to the protocols. I want to also mention other breaches that have also occurred here in St. Kitts. And these happen from time to time in relation to one of the protocols that have been introduced to combat mass gatherings. Mass gatherings we have been advised by our medical fraternity is something that we should be very careful about. And we define mass gatherings as an event if the number of people it brings together is so large that it has the potential to strain the planning and response resources of the health system in the community where it takes place. Consideration must be given to the location and duration of the event, as well as the number of participants. And so the question of mass gatherings is one in which a specific protocol has been introduced. And so when somebody wants to have a public event, or any event for that matter, the determination is that The number of patrons between 25 and 15 is regarded as a small gathering. And if you have between 51 and 100, a medium. 101 to 150 individuals is a large gathering. Now the protocols require that any indoor event should have no more than 100 patrons, and if you are in an outdoor environment, you can only have up to 150 individuals. So the concept of mass gatherings is being strictly adhered to. And I say so in the context that sporting events, whether it be football, basketball, athletics, have been to that extent restricted to be spectatorless in order for us to control the idea of mass gatherings that are seen potentially to be able to be a form of spread, the transmission of the virus, if it so happens to be in our community. We are very careful to adhere to that. Therefore, what has happened to us on this weekend is where someone will have a function and has to apply for permission from the police, and the chief of police has the authority to grant permission. We have found that more and more those who are promoters of events are exceeding the numbers for which those permissions are granted. And these two have had to be closed down. There will be strict adherence to these protocols, and if it is found that there is a breach of these protocols, if it is that an offense has occurred, these two will be brought before the court to answer for those breaches. And with those few words, I want to say that we are very supportive in the task force and throughout with what our health professionals have done. As we look towards the future, uncertain as it may be, we hope that the recommended measures would be efficaciously implemented to have the maximum effect in maintaining our low infection rate and non-existent mortality rate. I fervently hope that in the not too distant future that we would be able to reflect on COVID-19 as being a problem of the past that brought out the resilience and community spirit of the people of the Federation of St Kitts and Nevis. The COVID-19 threat is not yet over. We must therefore continue to promote health, safety, and vaccinate. Vaccinate. Thank you very much.
Thank you very much, Attorney General. We're now going to take a